Ugonjwa hii ni mbaya sana.
Ugonjwa hiyo vile ilinishika, nilikuwa na uchungu.
Singefanya chochote. Nilikuwa niko tu chini nimelala niko mgonjwa.
Life-threatening illnesses have been prevalent in Kenya. The patients undergo excruciating pain during and towards the last stages of such illnesses. Such pain reduces the patient's quality of life. However, to ease the patient's pain and make life a lot more bearable, they can be introduced to palliative care. According to World Health Organization, palliative care is an approach that improves the quality of life of patients and their families facing the problem associated with life-threatening illnesses. Through the prevention and relief of suffering by means of early identification, impeccable assessment and treatment of pain and other physical and psychosocial and spiritual problems.
You know, the most important thing with the palliative care is it empowers the patient, and it puts the patient in a very clear perspective of what is going on. So before palliative care came in, patients were moving from hospital to hospital looking for a cure of their disease, even though, you know, the disease was end stage, but they kept on moving from hospital to hospital. And that moving exhausted them. It exhausted them financially, it exhausted them socially, physically, and led to very poor outcomes.
Palliative care is a holistic service focusing on improving quality of life of the patients and their families by addressing physical needs like pain management, emotional support, spiritual and psychological needs. This is done through counseling, home-based care where the palliative care personnel visit patients at their respective homes, legal advice on patient rights, provision of pain medications such as oral morphine, antiretroviral drugs, as well as training healthcare workers and other caregivers on palliative care. The sick children are also put on pediatric palliative care program. Family bereavement, where the affected families are counseled during illness and after the death of a member, also take place in the palliative care.
The main problems that we actually address with the palliative care is we have patients with the terminal illnesses like cancer. We have patients with the advanced HIV. We have patients with the sickle cell disease. We have patients with the organ failures that are not amenable to treatment, or if it's amenable, they cannot afford it. For example, chronic renal failure, heart failure, liver failure, and many others.
Joseph Ndungu, a father of two, quit his job after he was diagnosed with anal rectal cancer. As a breadwinner of his family, he was devastated once told he had cancer. He had previously been wrongly diagnosed with stomach aches and amoeba.
Nilipofanyiwa upasuaji, nikapatikana ni tumor iko kwa intestine. Later nikaona sasa nimefanyiwa operation, nikafanyiwa hiyo colostomy. Nilipoamuka mimi nilijikuta tu niko na pahali nimefugwa, and that is it.
Ndungu says initially he almost lost his self-esteem when he had to use colostomy bags to pass waste, as he did not understand the problem. He thought he was the only one to have suffered anal rectal cancer, but when he joined the hospice and interacted with other patients, his life is getting back to normal.
Sasa kufika huku nikakuta hata kuna watu wengi wanatumia hizo colostomy bags. Tukashare vyenye mtu huwa anasikia juu, hata wakati huo siku anajua kutumia vizuri, nikaonyeshwa kutumia vizuri na nikasikia sasa yenye nilikuwa ninauziwa ilikuwa 450, na kuangalia quality yake ilikuwa duni kuliko yenye hata unapatiwa bure hapa. 51-year-old Lydia Wangeshi has lived with anal rectal cancer for 18 years.
She says she used to be very stressed as she could not afford the colostomy bags. Since she joined Nyeri Hospice in 2012, she has been getting them free of charge, much to her relief. Wangeshi and other patients collect colostomy bags every week during care and group therapy sessions at Nyeri Hospice.
Now I have 2 good years using the colostomy bag from here, and they are very comfortable. I feel comfortable when I am using them. Even my health is very comfortable because the time I started using this colostomy from this place, I feel so good.
Samuel Agola from Homa Bay was diagnosed with Kaposi's sarcoma. He may not have lived to tell the story of recovery had it not been the intervention of the palliative care at Homa Bay County Referral Hospital. Samuel says his left foot started aching in the year 2000 and he kept going to hospital, but when the pain persisted, he opted for a traditional healer whose interventions did not help him. He had many sleepless nights and unbearable pain that limited his movement. He could not walk, hence used his knees to crawl for 6 years.
Nikakaa kidogo, nikaenda kwa mtu mwingine anatibu, kwa hiyo anafanya matibabu ya kienyeji hivi. Nikajaribu huyo mtu kabla hajamaliza matibabu yake akafa.
Samuel has since received treatment from the palliative care team at Homa Bay County Hospital and can walk again. In Eldoret, Euphrasia Kwalimba is a breast cancer patient undergoing treatment and care at the Moi Teaching and Referral Hospital. Her breast started swelling, followed by neck swells that later burst, hindering her daily activities. She resorted to sleep due to excessive pain. Euphrasia was taken up for treatment at MTRH. When she met the palliative care unit personnel, she was given oral morphine to reduce pain. Morphine is a safe and readily available pain reliever for management of moderate to severe pain in both adults and children. She is recovering from mastectomy and says her life is slowly returning to normal. According to the head of palliative care unit at Moi Teaching and Referral Hospital, Susan Kipsang, other problems they address include cardiac problems.
Currently we see cancer patients. Majority of our patients are cancer patients because you can see that we are housed in oncology. Lately we have integrated other life-limiting illnesses. We see patients with cardiac problems, renal failure. We see patients who come in with chest problems.
Okay, we are dealing with patients with life-threatening illnesses. It can be cancer, it can be HIV, it can be even cardiothoracic problem. So patients diagnosed with life-threatening illnesses, we see them.
Palliative care education is key in ensuring delivery of end-of-life care is sustained. Kenya Hospices and Palliative Care Association is the umbrella body of hospices and palliative care in Kenya. Under the leadership of Dr. Zipporah Ali, the association sets the standards and curriculum for palliative care in Kenya.
We mainly focus on advocacy, training, helping to set up services, and also just scaling up the services that are already there, a bit of research, and also now currently working with the Ministry of Health to integrate these services into the public healthcare system. We've started with the former provincial hospitals, 11 of them, and now we are working with the 30 district hospitals currently to integrate these services. Some of them have done it successfully, others are just in the process, others are not yet there, but slowly we are hoping that they will get there.
The association has partnered with Tropical Health and Education Trust, THET, a partnership that has been instrumental in training health workers in 3 Kenyan hospitals, namely Nyeri, Homa Bay, and Moi Teaching and Referral Hospital in Eldoret.
Is one, they give us financial support to do the projects. Currently, they are working in several countries. Uganda and Kenya, and in Kenya they have helped us work with 3 district hospitals. These are the rural hospitals. It involves training people in these hospitals, training them first in the principles and the basic principles of palliative care, then going back and training them in other needs they might have that are specific, what we call modular training, and building the capacity of these healthcare providers. And it's across all healthcare providers, doctors, nurses, social workers, to be able to support patients who need palliative care. One of the things they've also helped us with is even just setting up the rooms for services, because when you go to these hospitals, you find there's no room yet for palliative care. So they might be given a room that needs to be renovated, painted, there's no furniture. So one of the things we're doing is also, they help us also renovate those rooms. So they have supported actually these hospitals, and I'm really happy to say that these hospitals are doing very well. They actually have set up palliative care services, are now seeing patients.
That's what is the Tropical Health and Education Trust has been working with us for the last 2 years and our project to integrate palliative care at the national level, but also to trickle down the services up to the community level. So they're having both up and down approach in terms of integrating the services, so that at least even the people in the villages can be able to access palliative care, and even the people in the villages can be able to identify people who require palliative care and refer them appropriately to the healthcare providers.
Since 2010, Kehpca has been working with other supporting partners, including the True Colours Trust, the African Palliative Care Association, and the Diana Princess of Wales Memorial Fund, to integrate palliative care into the public healthcare system, as well as the nursing and medical undergraduate curricula. Other sponsors like Treat the Pain Program, the Open Society Foundation, Hospice Care Kenya, Hospice and Community Care, International Association for the Study of Pain, and the International Association for Palliative Care. In 2012, Tropical Health and Education Trust THET funded this extraordinary program that focuses on 3 government hospitals, namely Homa Bay County Hospital, Moi Teaching and Referral Hospital, and Nyeri Provincial General Hospital, in building and integrating palliative care into Kenya's healthcare system.
We were able to select people who were interested in palliative care, and we put them on a modular program, which we have successfully run. And now we have a pool of trained people who have been sensitized towards integration of palliative care into the existing health services.
Tropical Health and Education Trust provides facilitation for these trainings, such as training venues and stationery.
In April 2012, the Tropical Health Education Trust, THET, awarded the University of Edinburgh and its partners, the African Palliative Care Association and Macquarie Palliative Care Unit, a grant of £1.5 million to support the integration of palliative care in 4 countries: Kenya, Rwanda, Uganda and Zambia. This programme works across 4 strands. One's around advocacy, supporting associations and key hospital leads to advocate for palliative care. The second's around workforce development, building staff capacity to deliver palliative care from managers, doctors, nurses, pharmacists, staff in outpatients departments and community. The third strand is around service delivery, looking at the systems that are needed for prescribing, for protocols, the procedures that are required to ensure that nobody who needs palliative care gets lost in the system and that everyone gets followed through. And the fourth strand is about partnership, because partnership's very important in working together between the UK and the countries we're working with. And mentors from the UK have gone to each of the 12 hospitals and linked with their hospital teams, and together they've learned and shared lessons and brought those lessons back into the UK again, so that globally and locally and nationally palliative care can be strengthened.
The training has avoided many cases like that of Ndongo in Nyeri, who says the doctor who prescribed an emergency operation did not have the courage to break the bad news. The fear of breaking bad news is not unique to Nyeri. It cuts across the board, but with palliative care training, health workers are able to handle it effectively.
The programme has made a difference. A number of hospitals have said, now we do have a stronger palliative care unit. Now palliative care is known within the community. Now there's ways of categorising and classifying our palliative care patients so that people do receive the support they need at the right time and the right place.
The training has done a lot of work, especially to me and the entire team. We've benefited. Before, me as a person, I used to fear disclosing sad news to somebody, especially when somebody has life-threatening disease. I used to fear. But after the training, I got the courage. Now, most of us in the group are able to pass the bad news to the relatives, patient, and I think that is a credit.
In the last 1.5 years that TET training has been going on, we have trained 55 people in the hospital, and out of these 55, 16 are senior doctors, senior nurses who head departments and divisions in the hospital. Regionally, you know, the hospitals that are surrounding Moi Teaching and Referral Hospital, we've been able to train 42 staff from those regions. We've trained 22 from this particular region and 20 from the western region, which is the neighboring province in this area. The official records that we have indicate we attend to about 70 patients per month who require palliative care.
In Homa Bay County Hospital, 20 health workers have been trained and the unit looks forward to training 40 more. Kenya Hospices and Palliative Care Association has played a key role in integration of palliative care into the Kenya's health system in partnership with the Ministry of Health. The head of Non-Communicable Diseases Unit at the Ministry of Health, Dr. Joseph Kehpca, says non-communicable diseases are on the rise, hence need for more palliative care centers in the country.
Between 30 to 40,000 people annually are diagnosed with one form or another of cancer, and with as many of between 20,000 and 30,000, succumbing to cancer of different parts of the body and at different stages in their lives in terms of years. Palliative care is really not necessarily for cancer care, and I think that's a misconception that sometimes goes around. Palliative care is just care for many of these chronic illnesses that reduce the quality of life and beget hopelessness and despair and pain.
Dr. Kehpca says the ministry has a lot in store as far as palliative care is concerned.
We want to make sure that we establish palliative care centers that are comprehensive, that you can get the other treatments within. And very soon when we establish cancer centers across the counties, they will also have a component of palliative care so that within the cancer center you are also able to get palliative care as a major component of that site.
He appreciates the support external donors and local supporters are giving towards palliative care in Kenya.
A lot of people are embracing the thought that even if you have funds, let's say for HIV, the same patient who has HIV ends up having a cardiac issue or dies of diabetes or dies of a cancer. So we cannot ignore non-communicable diseases because ultimately they are the ones which end up killing most of the people. The Tropical Health and Education Trust, which has come in very strongly to help both in supporting them financially and also in logistics and capacity building and opening up the field of palliative care.
Hospices have played an important role in offering palliative care before its integration into the health system. Services offered include day care programs, support groups and legal aid clinics alongside other palliative care services. Patients meet and share experiences as well as undergo group therapy. Nyeri Hospice has fully integrated legal aid in its program where patients receive legal advice from a volunteer advocate of the High Court.
We have been talking to them about writing a will, writing or giving a power of attorney to someone, the need to dispose their properties when they are still able to do so, and living, and related issues, the area of succession and child law, because they are also related, they go hand in hand. And we have seen tremendous improvement on the part of the patients, in that some of them have been able to write wills. Others have been able to transfer properties to their children and their wives and their husbands. Others have even come to us for purposes of going to court in areas where they would not be able to solve their issues at home.
Additionally, family members are supported through bereavement support groups where relatives of the patient receive counseling during illness and after the death of the patient.
My mom, she did accept that she had cancer, but once she came here for counseling, at least she started akaanza kupata hiyo, it is sunk in her that yes, I'm sick and I have to live with it for the time that God has given me. And also as a family, you get the counseling, so you are able to cope with life.
Eldoret Hospice contacts survivors to come and encourage the patients and their families during their day care program. Tokutukuza Trust is one of the regular visitors who come to Nairobi Hospice to lend a hand and support the hospice patients through encouragement, entertainment, as well as good giveaways.
What we actually encourage the community or well-wishers is to be supportive of such patients. So we encourage people to visit the patients during the support group, when actually they are together.
Here, the patients are taught entrepreneurial skills through activities such as bead making, weaving, and sewing. Though most hospices operate as outpatient facilities, the Gio Hospice in Limuru, Kimbilio Hospice, as well as Catherine McAuley Hospice in Mohoroni have gone an extra mile to offer inpatient facilities.
The reason why we started the hospice, we found when we went out visiting the people in their homes that some people had cancer and were suffering from a lot of pain, and we felt as a community that we should build palliative care units so we could treat these patients.
Kulingana na vile tunasomeshwa hapa, ukisikia pali kidogo na kuuma, piga kengele. Saa hiyo daktari yako kwa kitanda yako. Kwa hivyo huduma hapa sio zote, hatuwezi kudharau ile yote ya Kenyatta, lakini iko tofauti sana. Iko tofauti sana.
Palliative care has realized significant achievements over time. The achievements cut across between patients and palliative care staff.
Sasa niko na nguvu. Hata ikiwa haijarudi kamili, lakini kilichonifurahisha, ninaweza kutembea na kufanya kidogo kidogo yenye ninaweza.
Kakuru sayuro changa. Makuru wijo maber. Anu bende na nano kakuru ber na sahidi.
Niliona juu venye nilirudi nyumbani niliendelea tu na kazi zangu vizuri za nyumbani. Ndio kweli nilikuwa najisi ningali mgonjwa na lakini shughuli nilikuwa nashughulika tu vizuri.
Since introduction of palliative care units in various hospitals, the staff testifies to progress both to patients and society in general.
Markedly. Marked improvement. Yes.
Now there's ways of categorizing and classifying our palliative care patients so that people do receive the support they need at the right time and the right place.
Yeah, there's a lot of improvement because now at least they are in those who come with severe pain, the pain is lessened, so they are more comfortable. Yeah, so they are able to carry on with the rest of the treatment in a more comfortable state. It will be a good thing to integrate them into the system such that it doesn't look like they're a different group of patients.
Kehpca has enhanced integration of palliative care in the medical studies in Kenya. The association, together with relevant stakeholders, has developed a curriculum for diploma and undergraduate courses to equip the medical students with palliative care knowledge.
So this is the first time that came to starting such a program. And we are hoping that, of course, with time that we'll also even have a program at a degree level and at a master's level with one of the universities that will be interested to work with us.
Despite the remarkable progress, palliative care in Kenya is facing notable challenges. Kehpca attributes some of these challenges to the lack of a standalone palliative care policy in the country.
We do have a lot of challenges. First, there are very few people working in this field. There are very few of us working in this field. And the other thing is when the hospitals we go to work with, they also have a lot of shortages. They have shortages of nurses and doctors. So you'll find that a whole palliative care unit is being run by one nurse And also, of course, training. We don't have everybody trained in palliative care. This integrating palliative care into the nursing and medical curriculum is very recent, so we don't have people who have graduated that already understand what palliative care is. We don't have trained people, and then even if you want to train, the funding for training is not available. We have always to source this funding. For example, THET has been supporting us to train some of these institutions. And then also the other challenge is we don't have a freestanding palliative care policy by itself. It's integrated into the cancer, into the HIV, into the non-communicable disease document, but you don't have one that says palliative care, by itself as a policy. Sometimes you come across cultural challenges. People think that a hospice is a place for dying. That might be true maybe in the Western culture, but here really a hospice takes care of a patient from the time they have been given the diagnosis to the time, to whatever trajectory the disease takes. And the other challenge I think is also we would really like local support.
Other challenges facing the palliative care units across the country include lack of transport to access patients who require home-based care.
The challenge that we are facing, we find that many clients, majority of them, come when it is too late. They come when they are very sick. There is very little that can be done. And in terms of treatment or management, but in as much as they come late, we give them the drugs. We have morphine that we give them, and we give them to control their pains.
Superstitious beliefs in witchcraft drive some of the patients who should be on palliative care programs to seek alternative coping methods like visiting traditional healers, deteriorating their conditions.
One of the main hindrances for use of morphine in this palliative care provision is the negative attitude the healthcare workers had about morphine. And we have tried actually to beat that up. Through all this awareness creation, through interaction with the other healthcare workers, we have been able to actually reduce it.
Raising of funds is also a challenge as they do not have a source of money and mostly rely on charity works.
Most of the challenges that we face is about fundraising because we are not donor funded. We rely on the community, and you see that at the same time, every other time we go back to the community to look for funds.
Additionally, palliative care units do not necessarily have their own designated structures to operate from. Kehpca and all stakeholders are optimistic that the palliative care drive will eventually take root in Kenya's health system.
Needs a lot of effort from everyone. We cannot work in isolation as an institution or as a group of people. We need each other, and we need to scale up the advocacy about palliative care, and we need to support one another.
So we need to train more of the healthcare providers so that the integration is more successful. But the training, I think, should be spread down to even the community so that it starts with the community, when the community get involved.
We are in the process of establishing a fully fledged unit dealing with this. And in my budget, we have actually proposed some fund, not specifically for Homa Bay Hospital, but actually to help us start the Cancer Center and Palliative Care Center. And this we are actually looking for in our next financial year to actually help us function well.
We've managed to train quite a number of staffs within the hospital. At least in every department we've trained people, so that helps in the integration of the services.
Our idea is to set at least a space where palliative care patients can come to when they are being followed up, if they have issues, that there would be a unit where they would be referred to. Whether it is an outpatient or an inpatient wing of the palliative care services, we should have palliative care services being scaled up to a different level, that we can have centers of excellence in palliative care.
We're really trying to see if we can make this as a service that is just as any other service. Palliative care is actually everyone's business. It's not just my business, it's not just that nurse's business. In fact, we are having a conference, and our theme for this conference is palliative care is everyone's business. It's your business, it's my business. Please support your county, please support your patients. Let's make sure that palliative care is available, accessible, and affordable to every patient who needs it.
Why has the WHO declared that palliative care is everyone's business? In every country, everyone who's born in due course die. And normally deaths nowadays is after a number of months or years of distress. So there's plenty of time to start helping people when you think that they might well die in the near future. Not only should we try to cure them, but we should add in a new dimension of care, special care, sometimes called palliative care. Let's cure when we can, but let's care whenever we can, which is all the time. Let's go for it. Palliative care for all, palliative care by all.